All healthcare professionals participating in this podcast are paid consultants of Johnson & Johnson Surgical Vision Incorporated. Product indications and safety information will be available at the end of the episode. Welcome to this episode of Fine Tuned. My name is Rana Jaraha, and today we will be speaking with Dr. Sam Garg, Medical Director and Vice Chair of Clinical Ophthalmology at the Gavin Herbert Eye Institute at UC Irvine. He specializes in cataract and refractive surgery and external disease corneal surgery. Welcome to the podcast, Dr. Garg.
Thanks for having me, Rana.
So Johnson & Johnson Vision recently launched the TECNIS Simplicity Delivery System, a preloaded IOL delivery system. Let's get started by describing what the TECNIS Simplicity Delivery System is.
This is the next generation of the preloaded delivery system for the TECNIS monofocal lens that we used to call the ZCB00. The product code is now DCB00, but it's important to know it's the same quality lens, same optic, and same performance as the ZCB00 TECNIS monofocal lens you're used to, whether you used it in the preloaded system or not. However, when the lens is paired with the TECNIS Simplicity Delivery System, we're able to elevate the standard of care for our patients because it minimizes loading errors, streamlines lens delivery, and protects against contamination.
Got it. So many of our listeners may already be familiar with the first generation TECNIS iTech system. What are the differences between the two models?
Johnson & Johnson Vision has made several changes to improve the overall design of the delivery system. First, there are ergonomic enhancements. The size of the tip is unchanged, so you can still insert the lens in the incision down to 2.2 millimeters, but the system itself is bigger, which makes the device easier to handle. The plunger is stiffer, and the knob is smoother and larger, so even if your glove is wet, it is easy to grab and more comfortable in the hand. The larger knob also makes it so that you don't have to turn it as much to get enough rotation. The packaging was also reduced from a double pouch to a single pouch, and the device is packaged in a tray ready to use. So now there are no protective caps to remove and no waiting period to allow the solution to settle. With these changes, the number of procedural steps was reduced from 5 down to 3. However, the biggest difference is that the TECNIS Simplicity is approved for both BSS and OVD hydration, as opposed to only OVD in the TECNIS iTech.
What do you think some of the benefits are of using the TECNIS Simplicity Delivery System for the preloaded monofocal?
From an efficiency standpoint, there's less steps to get the IOL into the eye. It's very simple: hydrate, advance, and deliver. There's also the convenience factor of having everything ready to go in a single disposable system. There's no need to sterilize a separate injector. Safety is also a factor. Since there is no manual loading, the chance for loading errors is minimized. And because there's no handling of the actual IOL, there are benefits with respect to sterility and making sure you don't damage the optic or risk infection associated with contamination. The design is very thoughtful. The ergonomics assist with safe and accurate placement of the IOL into the capsular bag and a smooth controlled delivery into the eye. I also like the surface labeling, so you can easily look down at the sticker on the injector and do a last second check of the lens power and know you're putting in the correct lens power before it goes into the eye. Flexibility is also a nice benefit afforded by the TECNIS Simplicity Delivery System. We still have the option to inject the lens through the incision, and now we have the option to hydrate using BSS or OVD.
Now that we're on that topic, what are the advantages to using BSS over OVD with this delivery system?
Number one, BSS is readily available. OVD comes packaged in finite quantities, and there may not be quite enough to use the OVD in a preloaded system, in addition to what you may want or need inside the eye. For instance, I perform intraoperative aberrometry, and in a lot of my cases, I may have used all the OVD to fill the eye. Or if the technician filled a preloaded or even just a regular injector with OVD prior to putting what I need in the eye, I may not have enough of it. Then I'm in a little bit of a pickle, and I have to decide if I want to open up a whole new OVD just to fill up the eye, or whether I'd try to fill with BSS. Secondly, with the engineering changes made, using BSS instead of OVD can allow the lens to travel very smoothly through the system, opening in the eye with less chance of sticking. Depending on how the lens is loaded, any system can stick a little bit from time to time. From my experience, since I started using the new TECNIS Simplicity, I've seen that rate go way down. And finally, BSS is very smooth and doesn't obscure. Using BSS in the eye prevents getting OVD on your hands or obscuring the tip of the injector as you try to put it into the eye.
Have you noticed that using the TECNIS Simplicity system has affected your cataract surgical workflow and efficiencies?
Certainly, and not just for the actual surgery, but from an overall utilization of the entire workflow. From opening the package to sterilizing the trays to inventory management. We've already discussed the packaging and sterilization, but with respect to inventory, it's nice because we don't have to carry a separate cartridge for the IOL. These are the kinds of things that really make a difference when you're doing several thousand cases a year. Additionally, we have reduced our OVD usage. With both the iTech and the Platinum injector, we had to use OVD. Even though it's not necessarily a whole lot, sometimes you need just a little bit more. Personally, I would rather have the OVD available to use for something that I need for the patient.
I understand that you've had some experience using the TECNIS Simplicity Delivery System, yes?
Yes, I've been using it for several months now.
So, how would you describe the learning curve on how to use the TECNIS Simplicity Delivery System for a surgeon or technicians?
It is very intuitive for a surgeon who has been performing these types of procedures. It's a very natural transition, whether or not you've used it before.
You also teach residents, correct?
I do.
How does using the TECNIS Simplicity Delivery System for the preloaded monofocal benefit you when teaching residents?
One of the beauties of the system is that it doesn't require any kind of major skill set to use. Everything is consistent. The resident doesn't have to load the lens, which means there's less variability in how the lens gets into the eye. In the past, when I've had residents load lenses, the leading haptic may come out straight, or it could be bent over the IOL, behind the IOL, or the haptic may get crimped or bent going in. If a resident is too aggressive putting the IOL in the injector, it could produce marks on the lens. With the preloaded lens, we don't have to worry about any of that. We also don't have to wait as long for our residents to get enough experience to refine their technique. And even if they do get the experience, they don't necessarily refine it all that well.
Can you walk us through the steps?
Sure, first you will remove it from the packaging. Then add BSS through the little inlet. I usually put enough BSS so I can see it filling the whole cartridge. When the BSS starts coming out of the tip, I push the plunger forward and give the plunger half a turn. Then it's ready to go into the incision and be placed into the eye. The actual injection process is about the same as the Platinum injector, and some of these steps can obviously be done by the technician.
Can you share any pearls for using the TECNIS Simplicity Delivery System?
I'm happy to. You want to get familiar with it beforehand. Have a couple to practice with so you can feel how the process works outside the eye and surgery. And this is true for any system you use, not just the TECNIS Simplicity Delivery System. It's important you take your time with it up front and don't try to rush through. Get a sense for how the delivery mechanism works. Get comfortable with how much pressure there is as you turn so you will recognize if something does not feel right.
Got it. So, do you have any final thoughts you'd like to share in general about the system?
This system is great because it lets surgeons be surgeons. Loading the lens is not necessarily a surgeon's task since it does not require a major skill set. With the TECNIS Simplicity preloaded system, we don't have to worry about possible variability as a result of loading the lens. I'm looking forward to the availability of their entire line of lenses in this system.
Thank you so much, Dr. Garg, for sharing your expertise and experience with us. And thank you to our listeners for tuning in for another episode of Fine Tune. Be sure to subscribe so you don't miss future episodes. Thanks again. Indications and important safety information for the TECNIS One-Piece IOL with the TECNIS Simplicity Delivery System. Prescription only. Attention! Reference the directions for use labeling for a complete listing of indications and important safety information. Indications. The TECNIS Simplicity Delivery System is used to fold and assist in inserting the TECNIS One-Piece intraocular lens for the visual correction of aphakia in adult patients in whom a cateterous lens has been removed by extracapsular cataract extraction. These devices are intended to be placed in the capsular bag. Precautions. This is a single-use device. Do not re-sterilize the lens for the TECNIS Simplicity Delivery System. Most sterilizers are not equipped to sterilize the soft acrylic material and the preloaded inserter material without producing undesirable side effects. Do not store the device in direct sunlight or at a temperature under 5 degrees Celsius, 41 degrees Fahrenheit, or over 35 degrees Celsius and 95 degrees Fahrenheit. Do not autoclave the TECNIS Simplicity Delivery System. Do not advance the lens unless ready for lens implantation. The contents are sterile unless the package is opened or damaged. The recommended temperature for implanting the lens is at least 17 degrees Celsius, 63 degrees Fahrenheit. The use of balanced salt solution, BSS, or viscoelastics is required when using the TECNIS Simplicity Delivery System. For optimal performance when using OBD, use the Helon family of viscoelastics. The use of BSS with additives has not been studied for this product. Do not use if the TECNIS Simplicity Delivery System has been dropped or if any part was inadvertently struck while outside the shipping box. The sterility of the TECNIS Simplicity Delivery System and/or the lens may have been compromised. When the insertion system is used improperly, the haptics of the TECNIS one-piece lens may become damaged. Warnings. Physicians considering lens implantation under any of the following circumstances should weigh the potential risk-benefit ratio. A. Patients with recurrent severe anterior or posterior segment inflammation or uveitis. B. Patients in whom the intraocular lens may affect the ability to observe, diagnose, or treat posterior segment diseases. C. Surgical difficulties at the time of cataract extraction, which may increase the potential for complications. For example, persistent bleeding, significant iris damage, uncontrolled positive pressure, or significant vitreous prolapse or loss. D. A compromised eye due to previous trauma or a developmental defect in which appropriate support of the IOL is not possible. E. Circumstances that would result in damage to the endothelium during implantation. F. Suspected microbial infection. G. Patients with whom neither the posterior capsule nor the zonules are intact enough to provide support for the IOL. H. Children under the age of 2 are not suitable candidates for intraocular lenses. Do not attempt to disassemble, modify, or alter the TECNIS Simplicity Delivery System or any of its components, as this can significantly affect the function and/or structural integrity of the design. Do not use if the cartridge of the TECNIS Simplicity Delivery System is cracked or split prior to implantation. Do not implant the lens if the rod tip does not advance the lens or if it is jammed in the TECNIS Simplicity Delivery System. During initial lens advancement, quick advancement of the plunger is needed. Do not stop or reverse while advancing the plunger. Doing so may result in improper folding of the lens. After initial lens advancement and the half-turn rotation step, do not move the plunger forward until ready for lens implantation. Doing so may result in the lens being stuck in the cartridge. The lens and TECNIS Simplicity Delivery System should be discarded if the lens has been folded with the cartridge for more than 10 minutes. Not doing so may result in the lens being stuck in the cartridge. Johnson & Johnson Surgical Vision Incorporated single-use medical devices are labeled with instructions for use and handling to minimize exposure to conditions which may compromise the product, patient, or the user. When used according to the directions for use, the TECNIS Simplicity Delivery System minimizes the risk of infection and/or inflammation associated with contamination. The reuse, re-sterilization, reprocessing of Johnson & Johnson Surgical Vision Incorporated single-use devices may result in physical damage to the medical device, failure of the medical device to perform as intended, and patient illness or injury due to infection, inflammation, and/or illness due to product contamination, transmission of infection, and lack of product sterility. The TECNIS one-piece IOL should be placed entirely in the capsular bag. Do not place the lens in the ciliary sulcus. Use of methyl cellulose viscoelastics is not recommended as they have not been validated with the TECNIS Simplicity Delivery System. Adverse events. The most frequently reported adverse event that occurred during the clinical trial of the one-piece IOL was cystoid macular edema, which occurred at a rate of 3.3%. Other reported events occurring in less than 1% of patients were secondary surgical intervention, 0.8% vitrectomy, and lens exchange, 0.8% due to torn lens haptic.